If people have gas or bloating or you know, just a big belly and they feel gassy all the time, I sometimes ask them, I go into the history and I see some people swallow a lot of gas if they chew gum.
What do you call that if they swallow gases? It's got some fancy long names.
Yeah, it's called aerophagia.
So aerophagia, they swallow air and they burp up, and they have to burp it up. Make them nauseated, bloats the belly.
Sure.
So what do you do for those?
So we ask them to eat and drink slow, small meals. Avoid all the artificial sweeteners because they produce gas. Sometimes we ask them to keep a food diary and see what food has caused more symptoms. And sometimes we even put them on a fancy diet and ask them to avoid few things every couple of weeks and so.
So do you have ways to guide a patient to that good diet?
Sure. A lot of work being done on a FODMAPs diet now.
Now what is a FODMAP? FODMAP diet?
FODMAPs, in FODMAPs.
Wow.
It's a fancy name for basically all what bloats you up. It's fermented oligo, di, and monosaccharides and polys. And basically they're short chain, they're small carbohydrates. They're very hard to break throughout the small intestines. Even in us, even in normal people, they're hard to break. But when they cause gas, people perceive it as pain.
So give me an example of what they should take then on a FODMAP, one word, diet. Is there certain foods that you eat that make you less gassy and crampy? Because I hear people all the time saying they're gassy and crampy.
So there's two nice charts. It's like a traffic light. There's a green chart and then a red chart. And we usually ask them to eat off the green chart and avoid the red chart. Red chart would be something like milk and some dairy products. They can still do some hard cheese. They can still do some yogurt. Some fruits produce more gas. Some sugar, alcohol cause this. Some a lot of bad carbohydrates.
So a lot of times the patient needs to rely on the physician's knowledge and guidance in order to have a good belly.